how are you doing today?
Good, how are you?
Good. My name's Deanna, and I am a clinical laboratory tech student in my second year. I'll actually be graduating in a couple weeks. And I understand that you're wanting to talk to one of us about what the field offers and maybe more specifically what Illinois Central College has to offer as far as the clinical laboratory tech program goes.
Yes, I originally wanted to be a nurse, but after speaking with some students and also some nurses, I just don't really think that's what I would like to do.
Okay, well, I can definitely understand where you're coming from there, because I definitely thought that I wanted to be a nurse at one point in time. And the more I thought about it, the more I felt as if nursing wasn't a fit for me. And I actually didn't go to school for a couple years thinking that I didn't know what I wanted to be. And I had seen the clinical laboratory tech brochure and just kind of looked past it, thinking that it looked like a boring field, and I didn't really know what it consisted of, and there's no way that I could just push a button all day long and just do the exact same test over and over again. So I can guarantee you that's not what we do, and it's actually a lot more fun than that. One of the great things about our field is that we get to help the patient and do the greater good that health career students are seeking to do most of the time, but we have a lot less patient contact with that, and we're more of a behind the scenes worker, which is really great for some people that doesn't work out for, but it's just a personal preference, and it's one of the reasons why I really love the field.
Right, because definitely don't really want to be one-on-one with the patient. I don't feel like I know what to do sometimes or what to say in those situations with them, so something a little more behind the scenes would be great for me.
Awesome. All right. Well, what do you know about the field?
I don't know much. It seems like all you really hear about is blood and urine.
We definitely do test a lot of blood and urine, but we test other specimens as well. Anything from cerebral spinal fluid to feces to wound cultures from people with like an infected wound, or something is commonly encountered as strep throat. The throat cultures from that we do the testing on. So it pretty much comes down to any type of bodily fluid or anything we can get off of a body, we can probably do a test on.
Wow, I didn't realize there was so much that you guys got into in that field.
Yes. Actually, the lab is broken down into 6 separate sections. We have chemistry, hematology, blood bank, urinalysis, serology, and microbiology are the different sections, the regular sections of the lab. There's some other specialty areas, but the main sections are those.
I didn't realize that there was so much going on in the lab for clinical tech. What kind of degree do you have when you finish your initial 2 years?
Right now I'm in the ICC program. As I said before, it's a 2-year program. I will finish with an associate's in applied science, majoring as a clinical laboratory technician. I will then be hired on to work as a medical laboratory technician or a clinical laboratory technician. Both of the terms are used, doesn't matter. And then from there, I will be able to work full-time and possibly do a bridge-over program. There's different ones, anywhere from online, there's different ones across the state that you can get into and earn your bachelor's degree in clinical laboratory science. And that would actually make you a clinical laboratory scientist, or the old term would be a medical technologist.
Great, I'm glad that there's place for advancement in the field. I wouldn't want to tough getting into a job and not being able to go anywhere and feel like you're capped out as soon as you start.
No, I understand that completely. And even on from the bachelor's field, or in bachelor's degree, working in the field, you can even move into management. There's some people who become educators, or you can specialize in one of the fields, like the departments I told you about. You can actually become a specialist in one of those.
Excellent. I know a lot of people always think immediately with a lab tech about a microscope. Do you work often in the lab with a microscope during the day?
It is a definite possibility that you could use a microscope every day of your life working in a lab, just depending on what department that you're in. An example of this I could give you is when a doctor orders a complete blood cell count to be done, which those tests are ordered on people who come in with fatigue, just like generalized fatigue, to patients coming into the ER with extreme pain, complete blood cell counts ordered, because it tells you a lot about what's going on inside of the patient. So to begin with, the blood specimen is put on an automated analyzer, like we talked about before, but the machine is actually set up to flag if abnormal results come out from that sample. And once the machine flags it, it is the tech's responsibility to take the blood and make a smear with it, stain it, and then review it on the microscope slide. I can actually show you how to make a blood smear if you want to come back to the lab with me.
That would be great.
Awesome, all right. Well, let's go.
Let's go.